Great. Thanks for having us. I'm going to go first, and then Justin's going to go after me. So I just want to apologize in advance too. I have two very barky dogs, and it just started raining at my house, which is a recipe for disaster. So if you hear barking, I might pause and mute for a minute. What we wanted to talk a little bit today about is staying in the groove of type 1 diabetes with all of these changes that have been happening. Changes are just part of our natural lives, but we are definitely in a time today and space in life where we are having more changes than we ever thought possible. If anybody remembers the old song, Changes, always makes me laugh. But one of the things I talk with a lot of people about is change can be good and change can be bad or hard. So good change are things like graduations, changing to driving, changing from the school year to the summer. And change can be hard or bad, like what we're in now, the pandemic. I don't think many of us think anything is very good about that. But all of these changes are things that we will experience and things that we can cope with as we move through our lives. So thinking about change, there are lots of different factors that impact how we cope with change and how change impacts our lives. So first, some things to think about, are these changes planned? Graduating, going to college, getting a job, driving, summer vacation, all those things are planned. Sudden changes, did something happen that changed? So like right now, if we're in a pandemic, that was a sudden change. Death is, or loss of a loved one, diagnosis of type 1 diabetes is a sudden change. Is the change going to be temporary? So like what we're experiencing now, we all hope is temporary. So it's not going to be something that lasts forever, and that impacts how we cope with that change. Or is it lasting? Is this something that's going to change and be changed forever? So those are the things that we have to consider on that end. And then in addition, how do we deal with it? Can we predict it? So thinking about like summer vacation. Summer vacation is something we can predict. We know when it's happening. We can get ahead of it, think about our plans, make sure that we have things in place versus things that we can't predict or that sudden type of change. Can we control the change? So if we think about getting a job, one of the things that you can control with getting a job is where you work, how often you work. So thinking about what are the aspects of a change that you can control, or can you roll with it? Is this a change that's going to happen that while might not be your first choice or second choice, is it something that you can roll with and be able to cope with in the long run? So just some things to think about when we talk about change. How does change impact diabetes? Well, I think in a lot of ways, including like right now, when changes happen, it's a disruption in our routine, and most people sort of thrive on routines. We like to be able to know what we're doing and how to do it, and when something happens to change our routine, that makes everything a little bit harder to do. So for example, if you are used to getting up, having breakfast, getting ready for school, when your routine changes, maybe you're not getting up at the same time, you have breakfast later, you start school later or other activities later, that just disrupts your routine. It changes our eating habits. Lots of people, especially right now, I'm sure you've heard of the, catching or getting the COVID-19, meaning gaining the 19 pounds because we're all eating differently. Being at home has us have more access to food generally and tends to lead to grazing throughout the day. So our eating habits are changed, and that impacts diabetes. You think about going from having distinct meal times to grazing, that impacts your insulin needs and when you need to check. Excuse me. Exercise. Everybody, I think, is doing less exercise than we used to. I know for me, just getting up and going into work, by the time I got to my office, I was already 3,000 steps into my day. And now today I am at 3,300 steps, and it's the end of the day, and I took my dogs for a walk. So our exercise needs have changed in what we do. Mood concerns. Excuse excuse me, I'm going to talk more about this in a little bit, but change impacts our mood, how we cope with it, how we do things, the way that all of those other things come into play changes how we feel. And again, I'll talk more about this in a little bit specifically. Social interaction. Lots of our social interaction has changed. Thankfully, we have Zoom and video calls and are able to do activities like this where we can still have some social interaction, but we know that this interaction isn't the same and doesn't give us the same kind of benefit as in-person interaction does. Support is another thing that, particularly in the COVID times, I think has changed quite a bit and impacts diabetes and diabetes management. And I think that's true not only for the individual with diabetes, but their family as well. So if you think about, school and a school nurse or teachers who are able to provide additional support around the diabetes regimen, even just coping with how somebody is feeling. It's a period of time when your child is away and well taken care of and you don't have to worry. Now you're doing all of that. During the day, how we can support one another has changed because we have lots more competing demands. We're working at home, taking care of our kids. Some of us are doing school. It's a lot of change and changes how we have to support each other. And for a lot of people, it's really hard to ask for support, which we'll talk about a little bit more in a minute. And then age. Depending on the age of your kids and your other people in your family, that impacts diabetes regimens also. So younger kids going to need more hands-on support than a teenager, or maybe your teenager needs more hands-on support. And how we all are dealing with the pandemic and being at home and all these other changes that we've talked about definitely impacts how that child or teenager needs support in different ways. So, somebody who is doing really well, being very independent, taking care of themselves, now that everybody's at home and we're facing all of these other stressors, might need more support than you would think for someone of that age. Again, on the other side, with younger kids, being at home and having to do your job at the same time you're doing school, at the same time you're parenting, that extra support that that child needs might feel even more impactful. So how do we adapt to change? 7, 8 weeks in, I think we've all kind of gotten better at adapting than I think we ever thought we would be. I certainly have learned that I am way more flexible than I thought I could be. But just some tips to think about how to adapt to change. First, I think we need to acknowledge the suck. And I say that sort of tongue in cheek, but not really. I think it is super important to acknowledge how we feel and that things are changed and different and disappointing and we're missing out on things. So I think putting that out there, acknowledging that it's hard, that doesn't mean like wallowing in it or really getting into it, but just allowing ourselves, our kids, our families to say, this really is hard and I am struggling. And I think in addition to that, just acknowledging it, making time to express those feelings all the time. Know that feelings come and go. Lots of times we think about feelings as waves. They come, they crash over us, they recede. So having multiple opportunities to express those feelings, particularly the negative ones, is really important. It helps us all move forward. It also lets us know where those needs are. So if I'm kind of complaining or thinking about this one aspect a lot, that allows someone else that I'm talking about it to find a way to help me move through that or do something different. Next, I think we should look for any positive aspects. Is there anything better about what we're doing now? And this is not to be Pollyanna, like it's wonderful, I'm at home, I get to spend so much time with my parents or my kids. But really thinking, is there anything good? Is it better for you that you can sleep in a little later and start school or work a little later than you would have, or that you can take a nice long break in the middle of the day? So just kind of looking for any of those small positive things that you can hang your hat on. The other thing I think we need to do is acknowledge that we have to form some new routines or rituals. What we did when in the pre-COVID days is not what we can do now, but we can also still set up some other routines or rituals to make our days more predictable and feel a little bit better. One thing that I've been doing since my commute now is, 15 feet from one room to the other, is I get up and I go for a walk in the morning as my commute before I start work. So it's a way just to have that little bit of time that I used to have in my car, add some time alone to think and prepare for my day and kind of separate it and have a distinct beginning. So finding a new routine like that is really important. Other routines that families that I've been working with have tried are like having themed nights, where everybody gets to pick a different theme for that activity or movie or something like that. So just, again, really thinking about what are some new routines or rituals that I can predict and kind of bookend my day and my experience. Last, trying some gratitude. So there's lots of research to suggest that focusing on gratitudes and things that you're grateful for helps you have a little bit more positive outlook on life and focus on things that, like I was talking about before, finding those positive aspects. It also seems to boost our immune system. So that's also a nice bonus, especially at these times when we're thinking about illness a lot. If you're really interested in gratitudes, there's a lot of information on the Nationwide Children's website for our Honor Sleeps campaign. You should check it out. So, is it time for a new routine? Absolutely. In this COVID time, like I said, starting a routine is a really good way to help us like move through and cope with changes, starting that new normal. It's also a good time to think about what can I try out and see what works, even with diabetes management. So thinking about, different ways that kids or families have been managing things, and can we try something different? So I work with mostly people who have type 1 diabetes, and one of the things that I'm working on with several of my patients is it okay to be a little bit more independent at this time? Can you practice counting carbs, calculating doses with oversight, running it past your parents before you give it, but trying it out and seeing how you do? Is it time to think about, could you use your Dexcom more often or something else? Like using this opportunity when you have a lot more supervision to see what works. Or looking, again, same, I guess, kind of looking for better ways to do things. Are there better ways to give your injections? Are there spots that you haven't tried that maybe you could try? Are there other foods that you want to have? Just different things that might be a better way to do things. Is there a better way to communicate with your parents about information related to your diabetes? Is texting better? Is talking better? I think it's also a really nice opportunity for us to reset. I work a lot with patients who have been non-adherent or having trouble adhering to their regimen because it's just hard and it's overwhelming sometimes, and there gets to be a lot of distress between family members about taking care of diabetes. And this is a great time to say, okay, we've got this time, we're going to be together. Let's reset. Let's start over. Let's go back to the basics. Let's forget all the fights that we've had and go forward from here and see what changes we can make to really make things better. It's also a great time to think about getting help. I'm going to talk a little bit later about psychology and my role with the people that I work with, but this is a good time that if you've been struggling for a while, you don't have the same limits with school, reaching out for a therapist or some help, which could be short-term, would be great. And then finally, just starting that new routine, putting it into place, seeing how it works, and revisiting it as needed. I'll pause for just a second in case Christy wants to alert me there's any questions.
I don't see any right now. Remember, if anyone has questions, down at the bottom, there's a little Q&A box. You can just type your questions in there. I don't see any right now, though. Okay.
Yes, if you do have questions, I'll pause occasionally. I'm going to next move into mood concerns and just talking about mood and adjustment related to stress and times like this when we're experiencing changes. First, just kind of anxiety and depression. Thinking about general anxiety, we think about first phobias. I'm scared of spiders, I'm scared of different things like that. I see a lot of individuals who have needle phobia, which is very hard for kids with diabetes because we have to get over that really quick and not in the way that we would usually like to take it nice and slow. Thinking about general worries, just generally feeling anxious, unsettled, not being able to focus on what you want to focus on because you're having intrusive thoughts, having that anxiety all the time. These are all issues that we see a lot, and sort of on the other side, but we might see this a lot more now due to restrictions. So thinking about exposure to the media and news and hearing about the virus and illnesses and death can really increase that anxiety for everybody. And so one of the things to think about doing for everybody is limiting that exposure to things and times that you know you can handle or that you need, or just getting enough information without getting into overload. In terms of depression, we know that youth who have diabetes are at higher risk for depression than the general population. It's about 2 times the prevalence. So we really want to be sure we're checking in with people generally, but with diabetes in particular, to make sure that they're coping okay and doing okay with mood. Because depression can impact self-management, it decreases energy and interest and activities. It makes it hard to do anything related to daily functioning, but with diabetes in particular, those things can't be pushed off, so we need to be careful. And again, we might see this more now due to restrictions. So lots of people get energy from being around others, and since we are in a time right now where we have that less social interaction, that less support, all of those things that factor in before, we just really want to be in tune with it so that we're not missing anything. I also just wanted to talk about like general distress, thinking about general emotional distress. Having a chronic illness and coping with it can really cause just some general emotional distress, following a treatment regimen, dealing with the medical team, talking about your illness a lot, piled on with those family dynamics, the changes in dietary guidelines or things that you do, even though, you know, you might not change what you're eating, but just the more attention around food and being intentional, those changes in routine. I like to talk about the diabetes police. I think every kid I've ever met with diabetes has somebody that they would call the diabetes police. That's that person who thinks they know everything about everything and is monitoring them all the time. So right now, again, this might be increased due to less interactions and changes in activity. So some of those ways that kids and adults cope with general distress or anxiety or depression might be limited right now. Some people like to get out and exercise and do things, or be, again, socially active, or get that break going to school or to work. That's gone. And so we know that this might be increased. So really paying attention to everybody's needs in the home is going to be really important. I just want to highlight mood. I'm sure I'm preaching to the choir with this, but you know, blood sugar fluctuations definitely impact mood. Regimen tasks impact mood. If you're a family who's never had a fight over a blood sugar check or giving an insulin injection, please call me. I want to study you because it's usually something that comes up at any time. And also, diabetes is a roller coaster. So there are some periods of time where people are okay and everything's cooking along and they're doing great, and then others when they hate it. And that's totally normal. And again, because of what we're dealing with right now and that heightened anxiety or that arousal related to fear, anxiety, being cooped up in the house, changes in routine, all of this might be more prominent. So we really want to be very sensitive to any of these mood concerns. Not only in our kids, but in ourselves, because our mood definitely influences our family's mood and how we respond. So we want to be sure that we're checking ourselves as well as other people. I think some of my interns would kill me if I didn't talk about sleep, because it's so important. We know that getting a good night's rest and being well rested impacts lots of health behaviors and mood. So we really want to be paying attention to it. Right now, again, in COVID times, sleep has become a very prominent issue because our routines are disrupted. Lots of people are going into that almost like summertime mode where kids are staying up late, parents are staying up late and sleeping in late, maybe taking naps. And that disruption in sleep then has lots of negative effects on our health and mood. So we really want to be sure we're paying attention to sleep and sleep hygiene. I love my Sunday afternoon naps. So I'm saying that ahead of time, but the sleep people will tell you naps no more than 30 minutes. If you sleep longer than 30 minutes, you're going to disrupt your sleep later. I'm guilty of way longer than 30-minute naps, but you shouldn't do it. You want to go to bed the same time every night and wake up at the same time every day. That also means Saturdays and Sundays. So while that is very annoying, it's just something that we should strive for. Next is no screens, and I put within reason, especially right now, given the way we are able to interact with one another. Screens have become even more prominent, and so it's a little bit harder to really get into that groove of having no screens before bed. Ideally, it would be 2 hours before bed, but that's usually kind of unreasonable. So I think finding a period of time before bed where you can turn that screen off. And screen doesn't mean just phone. Screen means tablet, laptop, television, anything with a screen and a plug, so that you have some time to wind down. And then again, that wind down activity, something that signals to your body it's time to get some rest and we're going to go to sleep. So, you know, changing into pajamas, brushing your teeth, reading for a little bit, listening to some music, any of those would be a good wind down activity. Excuse me. And then a calm sleep environment. So it's a cool, dark room. White noise is totally fine, but we don't want a TV or anything like that. So again, paying attention to this is good, not just in COVID times, but like if you think about summer coming up and, you know, just a general desire to stay up later than we should, we really want to be paying attention to our sleep hygiene. Next, I want to talk about self-care. Self-care is super important for parents and for kids. As you'll notice, lots of these recommendations start to become, you know, a little bit redundant because they're coming up in multiple areas, but that probably means that there are good things to do. So setting aside some time to take care of yourself is imperative. Finding that routine, again, that's that word, routine. This is a new routine. We're all doing new things. We need to find a way to incorporate some self-care time into that routine. I like to say, you know, you can't pour from an empty pitcher, so you've got to have some time to fill up your pitcher, or you can't be a good partner, mother, friend, anything. So really thinking about self-care as beneficial to you, but beneficial to everybody that you care about. Make it a part of your day, put it in your routine, make it a restorative activity. I think it's easy sometimes to think of self-care as a time to get something done. But if it's not restorative, it's not going to really benefit you in the same way. So it might be like laundry, for example. If that feels like it's a task that's like on top of you all the time that you've got to get done, getting it done might feel restorative because it takes it off your plate. But for other people, it might feel like I just got a chore and I still didn't have time for myself. So the next one, time to oneself. That's a really key part of self-care. It's something that you do for yourself, usually by yourself, or with one other person. I also like to say, like, if you Google self-care, you'll get like 8,000 tips. They're all pretty much the same. But what fits for you is not what fits for everybody. So if you get that list, you look at it, I'm going to show you a slide with some things on it next. But if you see something and you're like, that's not me, that's not me, that's not me, don't do it. Find the thing that works for you and do that thing instead. So like I said, here are some just general activities. You can see some of them are movement, some of them are quiet activities, some of them are like turn your brain off activities, like watching a show. There is one, call a friend, that involves somebody else, like if that helps you and feels restorative. And the last one I put on there intentionally. Do whatever feels good. Something that's restorative, feels like it recharges your batteries, allows you to have some time to yourself so that when you return to whatever you need to do, you're ready to go and you feel better about your ability to care for other people as well. These are just some warning signs that I like to go over with families of things to look out for that are indicative that it might be a little bit more or a better time to reach out for some help. Having frequent DKA, certainly if you're in the hospital multiple times with the DKA for your child, it might be time to think about getting some professional help or approaching things in a different way. That elevated A1C over 3 to 6 months, usually I sort of look at like trends. So how is it for your kid? Is there a change? So like just using a certain number isn't going to do it as much as like what's different for your kid if it's starting to creep up. Thinking about eating behaviors changing, binging, restricting, having significant weight loss or gain usually means something's going on that we should talk about. Any of those acting out behaviors, again, like a change or something that feels like it's difficult to control. Kids engaging in risky behaviors, doing things that are dangerous or getting into trouble, starting to withdraw or isolate themselves from their peers, saying anything about depressed mood or feeling down. And certainly if a child endorses or anyone endorses any suicidal ideation, that's definitely a time to reach out for help. And there are lots of immediate resources. The hospital, Children's now has a psychiatric emergency department. So you can go there with trained professionals who can provide some crisis intervention. So if you notice any of those big changes, you're going to want to look for some additional assistance. I just wanted to give some brief issues in youth with diabetes. Adolescents, I love adolescents because they are way more fun to me than working with littler kids, just because I love sassy teenagers. But adolescence is at that time of transition and change. You know, kids, their job in adolescence is to differentiate from their parents. They have hormones. You know, this is really where it's kind of a perfect storm of difficulty with adhering to a medical regimen and coping with that and trying to be, you know, a grown-up. And again, this is more prominent right now because a kid whose job is to navigate all of these changes is now trapped in the house with their parents. And so we're going to see lots more potential conflict, lots more isolation, mood concerns, all of that kind of stuff. And some of it, you know, given what I just said, is developmentally appropriate, but we also really want to make sure that we're watching it, and there's lots of things that we can do to help navigate that time a little easier. So these are some of the helpful strategies that you know, I usually talk about primarily with the other providers that I work with, but I think they're good just like person skills to have. You know, certainly thinking about being warm and empathic to other people, trying to understand. I think being open and direct with our communication is very helpful, especially with teenagers and younger kids. They appreciate that frankness, trying to listen to all sides, definitely avoid blaming, which can be very challenging at times, helping people with coming up with solutions to problems, supporting autonomy. So talking with people, especially now, like I said, we're in this COVID time, it's a great time to start a new routine. It's a great time to kind of reset and move forward. So talking about this, how can I help support you? Becoming more independent since we've got time. How can I share responsibilities and setting some goals? Finally, just in case some things you want to think about doing, you know, encouraging our kids to do some more self-monitoring, providing incentives for the behaviors, not for the outcomes, you know, taking on more responsibility, whether it's related to diabetes or chores around the house, providing some reinforcement. Again, problem solving, looking to social support, JDRF, CODA, any of your providers can help. Thinking about what those barriers are for people who are having trouble with some adherence, whether that's to the diabetes regimen or to life right now, given where we're at. And then thinking about some multi-component things. We might have to do multiple things at one time to help somebody out. So just to give you a brief overview of what a mental health professional will do, so someone like me who works primarily with youth who have diabetes is to provide support to teens and families. I'm a good outlet for self-expression for teens. I often tell the parents I work with, I'm probably not going to say a whole lot different than you, but I get a little bit more street cred because I'm not mom, which is unfortunate and fortunate at the same time, I think. Really facilitating that effective communication, teamwork. that's within the family, within the medical team, at school, with friends, however that needs to be implemented, developing coping strategies with the family, again, helping with problem solving and coming up with novel solutions. I mean, one of the benefits of seeing a professional is, you know, I see lots of people who have type 1 and that I've come up with different solutions and seen what works in different families. So I can maybe come with some ideas that are different than what you've tried and might or might not fit with your family. So I really feel like it's a partnership between your provider and your family. I just want to give a plug for telehealth visits. Many therapists are doing telehealth visits right now by video or phone. I am working from home right now. Like I said, my dogs, who are being very good dogs right now, are wonderful receptionists. We're doing all of our visits by phone, or I'm sorry, by video. You can still get a new appointment if needed. So if you feel like you can't reach out for help right now, you absolutely can. The transition can be a little weird at first. So I've been doing this for about 8 weeks now, and I would say my long-term patients, we, you know, sort of got in this weird groove of like, here's my house, here's these things, you know, making sure everybody understands that it is totally private and safe and no one else is here when I'm doing my sessions. But then it's good. And so I would say overall, I think it's been really good. In a lot of ways, it's an interesting way to do treatment because it helps that you're in your own home and we can talk about things that are right there. So if you're interested, it's absolutely an option. Right now we are taking new appointments. And I think it is time for Justin, unless anyone has any questions for me.
Yeah, we do have one.
Okay.
I'll just try to read it off to you. Our son's friends have been breaking quarantine to get together. He is struggling because they are excluding him, presumably due to T1D. While he says he has no desire to break quarantine and understands the risk, it's really hard to be left out. Suggestions on how to address this?
That's a really great question. And I think especially in the next few weeks, as the state starts to open up more, we're going to be faced with that a little bit more. I think first I would just try to talk through it with your son. Like, how is he feeling? What aspects of it are really prominent for him? It sounds like not, excuse me, not the act of being out, but being kind of left out of even being invited. So depending on how comfortable he felt with like advocating for himself, I think maybe encouraging him to share that with some of his friends. Like, you know, I can't hang out with you guys, but it would be nice to be invited once in a while. And then try to explore maybe some other ways that he could still get those social needs met. Like, could somebody, and I'm fully prepared to be laughed at, but I can't hear you, so it's cool. Could somebody, like, you know, take him on the phone with them so he can participate kind of virtually while he's there, so he can still see what's going on and participating even though he's not there physically. And then thinking about like, okay, let's start making plans for when it is safe for you to spend time with your friends. How can we do that in a safe way that, you know, you feel comfortable with, I feel comfortable with, and maintain those same friendships? Hopefully that answered your question. And now it's Justin's turn.
All right. Can you hear me okay? Yes, okay.
Yep.
All right. So hi, everyone, and thanks for joining us. It's great to have you all here. My name is Justin Indike. I'm one of the pediatric endocrinologists here at Nationwide Children's. Get to work along Heather as well at times. She's an important part of our team, and we have quite a large team, as some of you may already know. So I'm going to be talking about some more details kind of on the medical T1D side regarding COVID. So I'm going to start with what we know. Well, so not a whole lot. Obviously, there's a lot that we can kind of give in terms of feedback, just based on expert consensus opinion, but there's not a whole lot known yet. As you may know, the medical literature cycle is one that kind of takes time, so it's only been maybe a couple months that we've been doing this. So we're starting to get more and more literature coming out, but there are some trends that we're already starting to know in terms of COVID-19 in general. You've probably been hearing on the news about, especially on the CDC guidelines, about certain risk factors, being older. They talk about 65 and older, certain comorbidities. And so you've probably all noticed that diabetes is listed on there. So the question comes up, should we be worried? I've already been asked that by many parents on some of these telehealth calls. So there hasn't been a definitive answer provided, but in speaking with lots of different colleagues and just looking at the evidence myself, the general thought that I would want you guys to know is that that kind of comment about diabetes as a risk factor doesn't necessarily apply to the 10 or 15 or 5-year-old that has had type 1 diabetes for a month, a year, 5 years, and is generally well controlled. Realize that when we say diabetes, kind of on a public health perspective, you're really mainly talking about type 2 diabetes, which accounts for 90% of diabetes all around the world. So for one thing, again, just diabetes as a general comment will be more or less type 2 diabetes. What we do know in general is that young people do better. A lot of them may not have many symptoms or mild, if any. We are hearing some reports, and we could go into it if there are questions about some of the post-viral conditions that some kids have been getting, but generally that's considered a rare thing at this moment. Generally speaking, we know that with type 1 diabetes or diabetes in general, that higher blood sugars are related to kind of poorer outcomes, increased risk of complications, and even acutely, we know that that's involved with increased chance of infections. We know that white blood cells, so the cells that that battle infection, won't work as well at higher blood sugars. So those are certain things that we know already. So some generalities, obviously it's best to avoid the hospital if we're able to manage at home, but at the same time, we want to make sure that people are coming to care if they really need it. We don't want people to be suffering at home when an IV fluid bolus could be really helpful and could help spark them and send them back home safely. So certainly seek care if it's needed. And if you or your child do have to be in a hospital and you're there for a diabetes related reason, certainly be your own advocate, be your child's advocate. We strive to achieve the best outcomes here at Nationwide Children's, but there are a lot of outlying hospitals that I've heard some scary stories, either just kids that I've received care or transferred care to our facility, or hearing from parents that they don't really know all that well how to take care of T1D. So it's really important to speak up if something's not going as you would want it to, because you may know way more than the doctor or the nurse that's treating your child about certain diabetes aspects. There are some case reports already in the literature about COVID causing DKA, kind of precipitating new onset diabetes, but still too little enough to make a whole lot of general conclusions. What we do know is that more study is needed. So until we get there, we really only have kind of generalities and that sort of thing. The good news is that research is ongoing. So Nationwide Children's Hospital is part of this T1D exchange, which is a nonprofit research organization that has helped organize essentially a multi-center quality improvement collaborative. And they've been collecting information on COVID positive, confirmed cases or suspected cases with T1D of all ages. So we're hoping to be able to present some of this data in the next few weeks. We don't have a whole lot of data to share with you today, unfortunately, but it's going to be helpful to give a better picture of who it's affecting, how it's affecting them, and some of the outcomes related to that. If you want more information, you can take a look at that website down there. When resource I do want you to check out is this alliance that recently was put together between JDRF and a group called Beyond Type 1. The website is listed at the bottom there. They recently released a set of behavior change goals and recommendations for people with diabetes. And this has been endorsed by, obviously, not just the JDRF or Juvenile Diabetes Research Foundation and Beyond Type 1, which is an important group related to releasing and distributing important information on T1D care, but also endorsed by the ADA, Harvard Medical School, ISPAD, or the International Society for Pediatric and Adolescent Diabetes, and basically kind of the international ADA, and dozens of other community partners. So there are 7 main points that they describe. And so if you check out on the website, they'll give you a lot more details. But just to give you a brief rundown, the recommendations. So together as a community, we will work to reduce or eliminate our exposure to the novel coronavirus by establishing and maintaining strict hygiene, minimizing our physical interaction with others, taking extra precautions if we do have to go out, and changing how we work to make it safer. In addition, we want to increase our baseline health to lower the risk of any severe infection for a couple of different ways. Managing our diabetes as well as we possibly can, maximizing baseline health, and getting treated quickly if we do get sick. And if you go on the website, each of these will be outlined in multiple different points. So I would encourage you to look that up. Some practical knowledge to bring up. So we'll focus on the basics. I like to keep it nice and simple. Diabetes is complicated enough as it is, so it's nice when we can kind of address things as simply as possible. Heather already went over some of these things, so I won't belabor the point too much, but just really important about regular exercise and optimal sleep. Both of them have important mental effects, as well as physical effects, diabetes effects. I've been talking to a lot of my patients and families and just commenting on how for physical exercise, for example, just, it's important for diabetes, but maybe more important thing than that, just for one's own mental health. I've oftentimes had to convince people to try to go outside and really try to joke with them that, ultimately COVID is a cold virus, right? So you're not going to get it from trees or the grass or a breeze. So it's really important to go out, get outside, get some fresh air. It's really going to be large crowds that will be a bigger hazard in general. So in addition to exercise and sleep, just the basics of staying healthy. So you've heard all of this before already, but certainly washing hands, staying clean, avoiding large social events, safe distancing practices, and especially nowadays as the state of Ohio is opening up and multiple states around us are starting to open up. I think it'll be important to try to be sensible about getting out there. Some people may not have quite the same priorities in terms of staying safe as you do, may not have the same insight on repercussions if we were to get sick. And so even as much as I need to get a haircut, I will certainly kind of take it slow in terms of getting out there and may wait a little bit to see if there's any chaos out in the community with crowds and crowds trying to get back into regular shopping. And then the basics of diabetes care and sick day management. So that's more on the next slide. So this is probably all stuff you've already heard, hopefully, but just the importance of general sick day management is going to be really important to try to stick with and optimize, especially with threats of coronavirus out there. So in general, the thought is to be aiming for a blood sugar between 70 and 180, what we call the target range. Whether or not you have continuous glucose monitoring or not, it's still a good goal to try to attain. How do you get there? Well, it's generally with blood glucose awareness. So either with regular frequent meter checks, or if you do have glucose sensor or CGM, that can make it easier. Certainly regular insulin is important, dosing with meals and snacks, and as needed for ketones. And then certainly checking ketones. So whenever there's significant hyperglycemia or you're not feeling well. Over time, I've heard from a lot of people that there's a misconception that they have to be high to have ketones. I've seen many times when blood sugar was totally in the quote unquote normal range, but they had ketones. Obviously, how we address them is a little bit differently. And we usually hand out materials at our clinic visits talking about how to address ketones in different situations. So we're happy to provide more information on that. It is really important to emphasize to never stop insulin. I've heard stories from people that they skipped their doses of insulin because they weren't eating, and then they also just skip the blood sugar check. So that's how you develop problems with ketones and DKA. So really don't stop your insulin. And then certainly maintaining proper hydration. So that's really important. Some important practical medical knowledge. So specifically for the pumpers, are there any changes to make during quarantine? One thing that I see from time to time, but more so now with the schedule changes, is be aware of that mismatch with the insulin carb ratios. The pump doesn't know that you're now in summer mode, and it doesn't know that there's a COVID crisis. What it does know is that at certain times of the day, the carb ratio will change and the basal rates will change and the correction factor may change. So now if your cutoffs for carb ratio is 7 o'clock and 10 o'clock and 3 p.m. for breakfast, lunch, dinner to cover those times for pre-COVID. Now with in COVID era, breakfast may be now kind of more in the afternoon, lunch is in the evening. And who knows when the bedtime snack is going to be. So in this case, actually, if your bedtime snack is 2 or 4 in the morning, as I was hearing from some of my teenagers recently on some of these calls, in this particular case, the carb ratio would be about the same. But for a lot of people, it is different times of the day. So take a look at that. Be ready to override if you need to get the dosing you want. Otherwise, you'll see a lot more inconsistency, because realize that a meal at 9:58 a.m. versus a meal at 10:02 a.m. now will get a significantly different amount of insulin. And so again, it's enough to already kind of drive you a little crazy, but it'll add more inconsistency. Do you need a new basal pattern for less physical activity? So the more sedentary you are, you'll generally develop more insulin resistance, and you'll need more insulin to address the blood sugars. Otherwise, you'll just see higher blood sugars. So you may need a new basal pattern. What else? So Heather already talked about telehealth. It's been great. And so we've really converted to almost entirely telehealth now. We're about to start to look into kind of converting back into more in-person, but I think it'll be kind of more of a tiered, gradual approach over time. So it really helps to be prepared. That's our time together. I want to make the most of it. So what helps is if you can review your blood sugar data beforehand, try to have it available, either uploading your information or even just documenting blood sugars on paper if you don't have any technology. And if you have ideas for adjustments, mention them. We really like to hear ideas. I don't like to hear that someone's had high blood sugars for 3 months waiting for our appointments. So we really try to strive to empower our patients and families. If there's a way to plan for an A1C lab check, one thing that isn't so nice about all of this is we can't do the nice finger poke in clinic to get your A1C. So we've been directing people to the lab and telling them to go in the morning to avoid the urgent care rush in the afternoon. And then certainly taking stock of your supplies. This is your chance to tell us that you're having problems with the pharmacy, problems with needing refills. So definitely let us know. Like I mentioned, being proactive and asking for help. We have dietitians and social workers and diabetes educators ready to, discuss any situation or idea that you have. Are there mental health concerns? We could help point you in the direction to get help from Heather and other important professionals like her. Address COVID-specific questions that you have. Are there technical problems with any of your devices? Again, this is your time. We want to make the most of it. And then certain details on the actual call. So finding a quiet, private location with decent lighting, we do want to see you, and it's helpful to be free of distraction. Setting up my chart in advance is good. Having Zoom downloaded so you can kind of access it. And just really highlighting that most of the work is done by you. So this is a slide that I got from a friend, Jeff Hitchcock at Children with Diabetes, just to kind of highlight that about 99.98% of the time of the care, it's really just you. It's really just a fraction of the time that we have with you in clinic. So really you guys are doing most of the work. We're here to help and guide and advise. So some take-home points. So know that this is really hard. This is really an unprecedented time with the COVID pandemic. There's a lot of change, there's a lot of stress. Trying to stick to the basics. If we are stuck at home, try to focus on what keeps you healthy with your diabetes, doing the right things, sleeping, eating right. Of course, kind of sticking with the safety precautions that we're all supposed to be following. Know that telehealth is here. Hopefully to some extent it'll stay, because it's awful nice to help our patients not have to drive hours to come see us. It's nice seeing pets on camera. So I didn't get to see Heather's dogs today, but maybe another time. And certainly working on blood glucose awareness, whether it's by meters or sensors, and then the basics of diabetes management. And even Google has a message. So I was looking stuff up and Google had all these points to bring up. So they're right about it. So I've listed some of the resources that I've mentioned. Hopefully you're aware of many of these. These are just a fraction of the ones that we are aware of that can be helpful, but hopefully you'll have a chance to kind of look some of these up in time. And then just want to take advantage of this opportunity just to kind of give a little bit of a shout out to JDRF, that their gala that's usually kind of in person, that helps us generate a lot of money to try to work on a cure and for diabetes, for type 1 diabetes, wasn't able to be held this year. So instead of this, we're doing 50 hours of giving kind of a marathon essentially. So there's a virtual auction, there's a fund a cure section. So you're invited to hear some details, and you may have received it already on the JDRF emails. So save the date, it's coming later this month. And that's basically it. Thank you for joining us. I did want to kind of emphasize self-care isn't selfish. So thanks, Heather, for kind of bringing up all those points. I feel refreshed just kind of seeing your list of ideas of things that I can do to kind of give myself more me time. But make sure you all take care of yourselves. That's really important. It's hard to take care of others if you're not at or near 100%.
Well, thank you guys. I don't see any questions that have come in. Remember, if you have questions, you can go ahead and enter them into that question box, and we can hang on for a couple more seconds, excuse me, in case you do have any questions. Don't see any more coming in.
We did okay with the thunderstorm.
Yeah, we did.
I see some lighter skies in the distance now.
Yep. Okay. Well, if there aren't any questions, then we'll go ahead and guess we'll end and say thank you so much for coming to this little virtual session. We do have one more coming up on May 20th. It's an off to college session with Tanner Barton. So if your child is in high school, even middle school, you can never prepare too early. Come hear tips from Tanner on what to do with type 1 in college. And you can register for that on our website as well. Yeah, I don't see any questions that have come in, so That's it. Thank you all very much for coming.
Stay safe. Bye, everybody.
Yeah.